This is Doug Field along with Brent Macy, and welcome back to the segment of Healthcare Consumerism Radio. We have joining us on the program today from Atlanta here, Kelley Clausen, who is with Intrepid, a leading benefit consulting firm located here in the Atlanta area. Kelley, good morning.
Good morning. How are y'all?
We're doing great, thanks. Say hi to Liz for us, okay?
I sure will.
Hey,
I sure will.
You know, I think what we've got to talk about today is a very interesting piece that sometimes goes ignored and not talked about enough in this whole, changing landscape around innovative health and benefit management. And, we put it in a bushel basket and entitle it Healthcare Consumerism. And that's the self-funding piece, because self-funding is not just for the big boys anymore, is it, Kelley?
I agree with that.
Yeah. So tell us a little more about what you see happening with self-funding and what some of the confusion is out there around self-funding.
Well, I think some of the confusion just goes back to some long-held beliefs that, frankly, weren't correct to begin with. And I think one of the basic ones that has been frustrating to me over the years is when you hear some people in the industry say that self-funding really only applies to employers of a certain size level, such as 250 employees or 500 employees or something like that. And it's really not as simple as that. And the good news is that I think folks are seeing through that the market has responded with some great self-funded options, I think, that will really work well in the world after PPACA.
Kelley, this is Brent. You mentioned PPACA. What is the benefit, or are there, through self-funding, what is the benefit for an employer if they decide they want to self-fund, given the PPACA?
Yeah, a good basic question. There's still the same classic advantages that have been there all along: state premium tax avoidance, avoiding state insurance mandates. You can improve your cash flow because of the run-out reserves that you can hold on to. They won't be needed later, though, when the plan is terminated, if it is. And there's also probably the most appealing from a direct financial standpoint, is that if you have good claim experience, good claim run, then you get to keep, as an employer, the underwriting profit. That's big. Mm-hmm. Another one is having access to data. Insurance companies, particularly in the smaller employers, are not really forthcoming with data, meaning what the amount of claims paid versus the amount of premiums, certain large claim information, things of that nature. So in the PPACA world, the way I see it is you can, avoid the MLR, the medical loss ratio issue. That's a subtle advantage to the employer, because insurance companies with the MLR mandate are really feeling pressure to strip down expenses, and some of those expenses really bring about good claim savings results, or potentially can. Disease management would be an example of that, although I'd be surprised if a carrier would, in good conscience, delete that. But there are other programs that are under pressure to take out of the expense portion. So under PPACA, with the self-funded program, you don't have that. With self-funding, you can be more aggressive in your cost management. You can really push the wellness programs, and by that I would say the real wellness programs that are effective, not just payroll stuffers. And you can also avoid the market share tax that the fully insured guys have to pay. So those are just the major examples as I see them. But having that flexibility and putting in wellness, for example, or more aggressive cost controls, and then getting back the immediate direct savings result is huge.
Are you looking at, Kelley, are you and your firm looking at, there's some interesting captives evolving as well that present some interesting, I call it the half-step model. I mean, if I'm an employer with 100 people, maybe there's this captive that I can jump into that gives me some of the same benefits of self-funding. Can you talk a little bit about captives and what is,
Captives are a great idea. I sure can. I like the idea quite a bit. And really what it amounts to is that you get like-minded employers that, for example, I referred to more aggressive cost control or more aggressive wellness. You get like-minded employers that really want to step out of the greater risk selection of most other employers and say, we want to have more control, we want to be more serious about it. And so they join with other employers inside of a group health captive. And the group health captive, really it brings some advantages, not only being a better risk mix, but you'll see some improvements on the stop-loss side or the reinsurance side, the excess risk coverage. And what they will do is they'll have a couple of layers of, without getting too technical, but what they do is that they spread some of the different layers of risk among these employers. And at the end of it all, they think, and apparently the results are coming out with some of the group health captives that are up and running, that because of the better risk model, these employers will see an advantage from a cost standpoint.
Do you, as an employer, am I able to stay away from some of these PPAC rules the same way that if I self-funded myself?
You can. There are some. I don't know that there's some ones that are major. The MLR I mentioned, but from an employer's standpoint, it's more of a subtle advantage. You know, the pressure that the carriers have to remove certain expense components from their 15% or 20%. Another one is the regulatory approval of insurance premium increases. You don't have that with self-funding. You can use other factors beyond the community rating factors, so there's more flexibility there. And again, the annual tax for the net premium, the risk sharing, you can avoid as well. So those are all advantages with self-funding that you would not have in the fully insured market.
Okay. Where do you see the self-funding, solutions for that, let's say that 50 to 250 employee base evolving, or in contrast with defined contribution private exchanges? If I'm a employer with 100 employees, why should I overthink and become self-funding? Why don't I just put my people in a private exchange?
Well, I think with the self-funding, you can once again, if you're going to be serious about your own destiny, and if you're going to take steps and measures that you believe will give maybe not an immediate return, but an intermediate to long-term return, then I think being self-funded and avoiding the aggregated underwriting that the exchange and the general market will have, I think self-funding is a good option for that. If you want to put in an outcome-based wellness program and put in some supporting wellness programs along with that, you can hope to see a good benefit impact on your claims and therefore the cost of the program. You won't necessarily see that. You might do all those same wellness activities under an exchange program, but you're not going to get the direct benefit of that.
Now, Kelley, are there any new variations of self-funding out there that have not been in the market before?
Well, there are, and the group health captive is a good example that you had mentioned earlier. But some others are kind of ones that have been around for a while and they have laid dormant just because of lack of market interest. Some of them actually slide a little bit back to the fully insured, but they take some steps towards self-insurance. You do have some of the issues we've talked about that the fully insured folks have, but for larger employers in particular, you see participating contracts again, meaning there's a dividend or deficit potential at the end of the year. We haven't seen those around for decades, and some of the big carriers are starting to do that. That's a step towards self-insurance, which is a good thing. Within the self-funded self-insurance market itself, you not only are seeing some new ideas as far as what the funding looks like within the self-insurance, but you're seeing them available to smaller employers. Back in the heyday of self-funding for medical back in the early 90s, you would see small employers down to, I think there was one stop-loss carrier, reinsurance carrier, that had a product for 11 employee-sized groups. And we haven't quite gotten there that I've seen, but there is a medium-sized, well-known carrier that has a program for 15 to 75 employee-sized groups. And I think that's wonderful because I've looked at that. I've actually recommended that at different times, and it works very well. Not available in every state, unfortunately, but you are seeing some things coming out of the incubator. Some are older ideas, and some are newer ideas. Another is what they call a level funding approach, where you just pay essentially up to the maximum in the reinsurance contracts, And at the end of the year, similar to a participating fully insured contract, there is a settlement. And some of the programs allow the employer to keep all of the good underwriting experience, the underwriting profit. Others split it with the carrier that sponsors the program. Pretty cool stuff happening out there.
Kelley, if you're going to introduce a good self-funding program and implement it and have it administrated, you need a really solid TPA, correct?
Indeed. Although there are some of the carriers that are getting down in that smaller size. But absolutely, partners are everything. Because there's good and there's not so good.
Mm-hmm. Kelley, I believe I read something a couple of weeks ago that the administration started to kind of look at the ability to self-fund your benefit plans. Were you able to catch up with that at all?
The administration, meaning the presidential administration?
Yeah. So the Obama administration and the Secretary of HHS began to kind of look at the self-funding options and what were some of the benefits employers were taking, becoming self-funding and moving around certain areas of the law. And I want to say that I read something that said they were going to take a look at that. I just didn't know if you caught up to that at all or how this all factors into PPACA even deeper.
Well, to tell you the truth, I don't know that I've seen that specifically, but what I have seen is a trend overall, like in certain states, not necessarily federal, but some states, are really what I would say discouraging some of what we're talking about now, and that is self-funding programs for smaller employers. Mm-hmm. And really it's because of that unfortunate conventional wisdom that was bought into before, quote unquote, it's not for small employers. And they just can't get past that, it seems. And there are some states, and I would be hard-pressed to name them specifically, but could easily come up with that, but they're trying to say you can't have a reinsurance, a specific reinsurance, specific stop-loss deductible below a certain level. And it may be as high as $50,000. Well, that might exclude, or even $75,000. That might exclude certain employers from jumping into this idea because it makes it more untenable. It's harder for them to manage their risk.
Now, Kelley, we got about a minute left on the program. Kind of give our audience kind of one or two really good takeaways and let them know how they can find you guys.
Well, thank you. One of the big ones I would say is just dealing with that conventional wisdom. Is it safe for smaller employers? I think it is, but I think the big thing is it's not for everybody. Certain employers need to have I think the size is probably the last thing that ought to be considered. Instead of that is the attitude that I want to control my plan. That's very big. Do you have that longer-term perspective? And do you have strong cash flow? If you can get past those first two, then you can go to the size. Is it appropriate? I would be hard-pressed to recommend this to a 7-employee group, but I would feel real comfortable with the right program of saying, if you have 20 employees that are covered, yeah, this could make sense for you. At least there's a program out there that could. So what has been considered an untouchable now I think is not only untouchable, but you can have a lot of success with it.
Well, Kelley, thank you so much for taking the time to be on the program today, and have a great long weekend to the rest of our audience. Stay tuned for the last segment of Healthcare Consumerism Radio.